Good evening, everyone. My name is Nikki Moffat-DeVries, Consumer Marketing Lead for Insulin Australia, and I'm your host for this evening's Q&A webinar, Omnipod was my choice. We'll just wait another minute or so to allow people to dial in and connect through to the webinar. Let's sit back, relax and enjoy as we talk about the importance of choice in insulin pump therapy. Before we start, and in the spirit of reconciliation, Insulin Australia acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Let's start by quickly talking about how an insulin pump works. Insulin pumps can replace the need for multiple daily injections and work by drip feeding small amounts of rapid-acting insulin throughout the day. The pump delivers insulin through a small cannula that is inserted under the skin. The Omnipod DASH system is a tubeless, simple and discreet way to deliver insulin. The system comprises two simple parts. The pod, shown on the right, is a small, tubeless, waterproof device that you fill with insulin and wear directly on your body. The pod can be worn almost anywhere you would give yourself an injection. The Omnipod DASH Personal Diabetes Manager, or PDM, is a smartphone-like device that communicates with the pod via secure Bluetooth. You can carry the PDM in your pocket, backpack, or handbag. So let's introduce our speakers. Dr. Kenny Clark is a GP with a passion for the care and management of diabetes and general health. Dr. Clark runs the Diabetic GP Clinic, which is a multidisciplinary centre focused on people with diabetes. He has many areas of interest, including diabetes management, insulin pumps, chronic disease management, and many others. Welcome, Dr. Clark. Our second speaker tonight is David South. David wears many hats, including labour hire business owner, construction worker, and mentoring business owner. Most importantly, David is the father of 6-year-old Charlotte, who was diagnosed 18 months ago and has been using Omnipod since August last year. David and Charlotte have experienced a rollercoaster of emotions since Charlotte's diagnosis, as they experienced a lack of choice in diabetes management options. A very warm welcome to David too. Our first question for the night is to Dr. Clark. Kenny, who would you consider for tubeless insulin pump therapy?
So that's a very good question. Thank you. So who's the best to get a tubeless pump? So it's a very good question, and I've always said that diabetes is a behavioural condition. So there's the tubed systems that you can have. They have got benefits, obviously. But if you've got someone who doesn't want to have something that they have to remember to live by a certain set of rules, i.e. you sometimes have to disconnect a tubed delivery system, and then you may forget to re-put it on, or it's not fully waterproof, or you don't want something attached to you that can hang around in the wind, so to speak, then the tubeless delivery system is probably going to suit you. So it's all about that progression from a huge burden on your life to a little bit less burden on your life to something that could reduce the burden even further. And I think that's where you give the patient the options, and they're the ones to choose. I hope that answers your question.
Thank you, Dr. Clark. Our next question is for David. David, Charlotte was diagnosed with type 1 diabetes 18 months ago. What was your experience navigating those early days before Charlotte started pod therapy?
Okay, thanks, Nikki. So our early days were quite challenging, and I think many parents who have gone through similar experiences, there's an emotional sort of roller coaster ride with diagnosis and just coming to terms with this sort of life condition. I think after we left hospital, I wasn't quite convinced about the therapy and the tube pump therapy that we were directed to use. I really didn't think that that was the right fit for us and for Charlotte. I think mainly because it just felt so big and cumbersome for her. She was only 4 at that stage. Yeah, look, I can still remember, breaking down, on multiple occasions, particularly when I was doing set changes, particularly when I was disconnecting her and then reconnecting her after a bath or after a shower. And, those times as a parent are times where you really want to have special skin on skin kind of moments with your child. And, it just felt like there was always this division that we had between us for some reason, because it was just a really big and bulky device. So yeah, I mean, our experience was really difficult, and I think any parent going through the same journey would sort of agree with me that those early days, you've got your child in bed with you a lot because you're setting alarms, you're trying to check their blood glucose levels every couple of hours. Rolling around with this thing in the bed, and I just felt really disconnected from Charlotte, which was really quite distressing for me.
It sounds like it was an extremely difficult time for you. Thanks,
Yeah,
David, for sharing. Our next question is back to Dr. Clark. How can a tubeless insulin delivery system help people living with type 1 diabetes manage their blood glucose levels?
Again, thank you for the good question. There's as a doctor here, when I'm trying to manage a patient who is on multi-daily injections, it is extremely difficult. And as I'm telling the patient, this is how you're going to have to do in this situation. See how your CGM shows this trend. This is what we're going to have to do in that situation. It ends up being that as I'm saying it to the patient, I think this is ridiculous. Like, I am asking this person to act this way. They're going to be able to do nothing else. They're going to have to stop what they're doing. And, then, the tubed pumps came along and they've reduced that burden down. But what happens then is you've still got to stop your day to get the tube system out, or whatever the system is you interact with that pump is, and you still have to stop and interact with your diabetes, and that takes time out of whatever you're doing, whatever else your child's doing. So a tubeless delivery system reduces that, that amount of time you have to put into diabetes, and it reduces the burden. So by reducing the burden, you spend less time on diabetes, you spend more time living, your BGs automatically get better because it's easier to influence your blood sugar. So that's what I think tubeless delivery systems can offer people definitely over multiple daily injections, and I think over the tubed delivery systems.
Thank you. David, how would you describe your experience when you first switched to Omnipod? How did you go once you were able to access Omnipod? What was it like learning how to use the Omnipod DASH system? And what was the first pod change like?
Yeah, okay, so I'll try to answer most of that. I guess in a few words, I could say basically it was life-changing. Omnipod wasn't subsidised at the time that we accessed it, but Insulet were doing a lot of different deals, and I had a really supportive educator who allowed me to have this choice over, let's start this tubeless pod system with Charlotte. And what's the worst that can happen? We'll digress back into the tube pump. So for us, it was life-changing as soon as we started jumping on it and learning how to use the Dash system. The interface was super easy. It's quite intuitive. I'm all over Charlotte's ratios, her basal program, and that type of thing. So it was really easy just to transfer that information into the Dash system. I guess as far as the first pod change went, it's funny, Dr. Clark was touching on, you stop thinking and you're able to sort of start living a little bit more. And for me, disconnecting and connecting and doing set changes was always quite a stressful period between Charlotte and I. I can always remember having to prep myself up for it because it was quite distressful. And that kind of stress can also influence Charlotte's levels as well. We all know how hormones and cortisol and stress response sort of can influence. So having a smaller device that was less intimidating, less cumbersome to use, made her feel more comfortable. It made me feel certainly more comfortable. And so, that first change, I can remember the relief that I felt, as opposed to some of the anxiety that I used to feel with having to prep cartridges and go through that whole sort of set change scenario with the tube pump. So yeah, in a few words, I could say it was life-changing when we first started.
Our next question is for Dr. Clark. How can a tubeless insulin delivery system help manage days like sick days and sport days?
Yeah, this is the tough one. This is when you're getting into the nitty-gritty of whether your settings are correct or not. So back in the olden days, you'd have less insulin because you're going to be active, okay? Or you have to eat to be active, or and now these systems have got algorithms and equations. And I've got a little old saying, if you do something 3 times a day, you can automate it. So that's where these tubeless delivery systems can automate sick days, pre-activity settings, activity settings, post-activity settings, and all now the touch of a button. So the tubeless thing is got an advantage, I believe, because again, you don't have to stop what you're doing in order to keep doing sport or to be somewhere where it needs to be disconnected for another system, because it's still on you, it's always there, and you don't have to suspend and disconnect and then come back to it 1 or 2 hours later and have to catch up for the next 3 or 4 hours. You can just, at the touch of a button, put your pre-exercise setting on, then your exercise setting on, and then your post-exercise setting on. Or heaven forbid you become sick, you can put on a sick setting. And it's all automated. Everyone knows the more you can automate something, the more efficient you're going to be. So that takes the burden out of the old-fashioned way. Yeah, we're getting there eventually now, I think.
Thank you, Dr. Clark. David, can you share your overall experience with pod therapy in terms of quality of life, both for Charlotte and for you?
Yeah, sure can. Our overall experience has been awesome. Charlotte participates in all different schooling activities now. In that slide, she's got a little first ribbon in swimming. So, we don't have to worry about kinks and air bubbles and all those sorts of things. I shared a story not long ago about watching Charlotte's old pump drag behind her at a sporting carnival, and having the tubes sort of hanging down, which was pretty terrible. So now we get to enjoy sort of seeing her participate as a normal child. We used to have to disconnect for swimming, and I used to always find Charlotte's blood sugar levels would rise quite significantly, and particularly with then sort of trying to monitor from her CGM and sort of feeding her food as she's exercising and swimming. Swimming takes a heap out of you, especially little kids. Now we leave the pod on, obviously, and we just do a temporary rate so that she's still getting some kind of background and going in, so that whatever we're feeding her is getting delivered to her body in the right way. Kids' parties are awesome now. I used to feel really anxious rocking up to a kids' party. One of the strategies I do is I actually turn her basal rate up so that she can graze. Kids' parties are all about running around, coming back to the table, running around, coming back to the table, right? So for us, one of the strategies that I'm using is we don't have to disconnect the pump so she can run around and climb on the monkey bars and do all that kind of thing. She's running around being a normal child, and I turn the basal level up so she can keep grazing. I'm not having to bolus her, and then I'm stacking the insulin and losing track of what I've done, and then all of a sudden either having a terrible low or not having too much. So our overall experience now, and watching Charlotte just enjoy life, and as Dr. Kenny says, you don't think about things as much, so your blood sugar levels and your averages start going down. It's awesome. We're in a great place now. Our quality of life is good, and it can only get better in the future, as far as I can see.
That's amazing. Dr. Clark, what has been the feedback from the people that you have commenced on tubeless insulin delivery systems?
You know, it's you don't think it's bad until someone else shows you how different it could be. And I think that's the sort of main feedback I get from patients when we see them the first time after they've put the tubeless delivery system on.
David, before I ask this next question, I actually have a question from the audience. Does the Omnipod fall off when Charlotte is swimming?
Great question. Look, in our experience, what our strategy with that is we allow Charlotte to go into the water and muck around, and then we try and have strategies around her coming out and drying off every so often. We all know that even with the CGMs, the sticky pads, if they're submersed in water for a really long time, to become waterlogged, and there is that opportunity for the adhesion to lose its sticking power, so to speak. There are really cool patches that go over the top of the pod, which provide a little bit more support. So we sort of prep ourselves with a day to the beach or a day in the swimming pool, where we put an additional patch over the top that provides some support. And I think the other thing with high activity, to sort of go a bit further into that, when Charlotte's at gymnastics, we actually put like a wrapping over the pod. And because, and the same with the CGM, there's always going to be sort of little mishaps with that type of thing, but I think the benefits far outweigh some of those sorts of scenarios that come across your table.
Fair enough. She's a very busy girl, and it's important to remember that the pod has a waterproof IP28 rating for up to 7.6 meters for 60 minutes, but the PDM is not waterproof. David, what has choice meant to you throughout Charlotte's diabetes management journey?
A choice is everything, and empowering yourself with knowledge is super important. It's a life journey, right? I think it's really important that you find the right educator that supports you, and I feel like there's going to be many more choices that we need to make along this journey as well. It's a life journey with your child. So having that support from your educator, empowering yourself with knowledge, and being able to, have your concerns heard is super important. So choice, for any parent in the pursuit of trying to find the right fit for them, their lifestyle and their child, because it's such an individual case by case, is super important. We all recognise that type 1 is not a one size fits all. So as far as the hardware that we're using to control our diabetes, I think choice is super important from a parent's point of view. Yeah.
Thank you. So our final question for you, Dr. Clark. What do you say to people who are unsure about tubeless insulin delivery systems?
One of the biggest things before the tubeless insulin delivery systems were available was the commitment. So currently there's a bit of a two-tier healthcare system in Australia where people can afford insurance and then they can afford insulin delivery systems. The drawback being, if you want to try a tubed insulin delivery system, you're kind of, committing to quite a substantial time with that system, and you can't go back. There are some rare options where you can get a try for 1 year, but it's still very difficult. You're making a big decision and a big commitment financially as well. So I think the fact that the tubeless insulin delivery systems have got this sort of, month to month ongoing contract between insurers, and if you want to fund it yourself before you try, I think it's reasonable. So, if you say to someone, if you're not sure, you can try it for 1 month. And if you don't like it, at least you tried. Or you say, right, we're going to try it for 4 years. If you don't like it, tough. You can change your mind in 4 years. And they can see that, you know what, I can try something for a month. Yeah, I'll give that a go. And if they can't afford insurance, they can usually afford the 1 month of the pods to see if it's worthwhile to budget for that. So I think that's my sort of chat with the people who are not sure, because it's a big change and it's a financial commitment. But if you're only committing to 1 month instead of 4 years, it's a lot easier to swallow.
And our final question of the night before we go to the questions in the chat is, what advice, David, would you give to your past self when considering diabetes management options for Charlotte?
Ask more questions. Trust your gut. And really seek out what therapies are available and what's current. It's a very fast-paced, moving world, and such as the same things are happening in the type 1 community with technologies to manage. So if you're researching, if you've got your finger on the pulse, you trust your gut, ask questions, and find a really supportive educator that's going to support you with the choices that you want to make as early as possible, is what I would probably tell myself.
Thank you. So how can you access Omnipod? The Omnipod DASH pods are listed on the National Diabetes Services Scheme, or NDSS. There are 2 ways eligible people can access NDSS subsidised Omnipod DASH pods. If you don't have private health insurance, or if you just want to try Omnipod DASH, you can take advantage of our monthly no lock-in subscription where you can pay as you pod. The other way is with your private health insurance. The insurer pays a one-off payment covering 4 to 5 years of access. The NDSS dispensing fee is also payable for both options to get the pods themselves. If you're interested in finding out more, please scan the QR code to go to our website. I do have a question for Dr. Kenny Clark. Dr. Clark, do you see an improvement in time in range in HbA1c when people first switch from MDI to pod therapy?
Well, yeah, there's actually journal articles on this. Yeah, absolutely. Now, we all know that HbA1c isn't the be-all and end-all anymore. It's all about time and range, really, and time and fluctuation. So, yeah, HbA1c definitely does improve, but that's not the story. The story is the reduction in the burden. That's what's important to patients. Diabetes can be a numbers game, but you got to look at the person behind the number and say, your HbA1c went from 7.2 to 6.9, but what did you do to get there? Did you try really hard? Well done. Or did you change systems and try less? That's a much better result in my eyes. So, it's not all about, HbA1c and time and range. It's about the experience, and people vote with their feet. If you've got a good product and a good experience, they keep coming back. So, look past the numbers and just look at the life.
We've reached the end of our webinar now. I would like to thank our speakers, Dr. Kenny Clark and David South, for their time and sharing their perspective on tonight's topic. I'm sure everyone tonight will have found the webinar both interesting and informative. Finally, on behalf of Insulin Australia, I would like to thank you all for attending. Good night and enjoy the rest of your evening. Bye for now.